Hello, everyone, and thank you for joining today's webinar, A Necessary Pivot, Virtual Case Management and Coaching Amid COVID-19. I'm James Butler, and I serve as one of the program specialists with the Office of Family Assistance under the leadership of Lisa Washington Thomas, Director of Self-Sufficiency Technical Assistance. As you know, COVID-19 has turned our world and the way we used to do things totally upside down. In an instant, we seem to have found ourselves working from our homes, becoming the daycare provider, the school teacher, learning about every conceivable technology platform made, and in addition to that, some of us began to question the brick and mortar paradigm that we've held so close for so long. The Office of Family Assistance has been working closely with states and tribes to understand how their programs have adjusted to the work from home transition, including how program staff are connecting with TANF customers amid this pandemic. Today, we bring to you some incredible panelists to talk about the critical transition work that still needs to continue each day. Our discussion will include programs considerations when making the transition to virtual work, what staff and customers have learned as a result, and what that learning will inform as states and tribes slowly transition back to what will be a new normal. Our objective during today's discussion is to share some key considerations for implementing virtual coaching, case management systems, provide some tips on how you can become more familiar with outreach and discussion techniques during a crisis, share some suggestions on how you can help TANF participants feel connected and develop resilience during times of crisis, discuss the experience of different TANF programs with virtual coaching, case management platforms, and identify HIPAA-compliant platforms, systems, and connectivity to broadband and other resources that you can use in your daily work. What I'd like to do now is transition over to Mary Roberto, who will share with you some of our background.
Thank you, James, and hello, everyone. My name is Mary Roberto, and I'm the project director for PeerTA. I work with Manhattan Strategy Group in Bethesda, Maryland. I am so very excited to welcome our panelists back for a follow-up conversation about this important conversation, a real interesting topic during these times. As James said, the presenters have a real good, solid background in virtual coaching and case management from their time through the start of the pandemic all the way through to today, where they've learned a great deal, both from the research side and from the practice side. Really diving deeply into the platforms and broadband connectivity, as well as emerging strategies that I know will be thought-provoking as each of you navigate your work now and into the future. As some of you are already aware, the PeerTA, OFA PeerTA is the state and tribal TANF connection to peer-to-peer training and technical assistance through the Office of Family Assistance. PeerTA offers TA to states, counties, tribes, local agencies in the form of things like peer-to-peer roundtables, site visits, workshops, teleconferences, environmental scans, and events like the panel webinar today that's connecting you to the field to hear all the interesting and innovative work that's occurring during this time. At the end of the presentation today, we'll show you how to access the PeerTA website and explain how TA requests are submitted towards the end again. This webinar will be a little different than those that you've attended in the past, where we won't have a formal panel presentation. Instead, we'll have an organic discussion based on the questions that were submitted during the May event, the May webinar, and as well as those submitted through the registration process and those that we've developed. I also want to turn your attention to the handouts that have been uploaded to the recording that'll be connected to the recording once it's posted, as well as that's information on broadband access for low-income families, as well as information that Annette and some of her colleagues with ASPE put together that you can read. Really good information and thought-provoking as well. As mentioned earlier, we're very fortunate to bring these three presenters back to discuss the information that we discussed in May, go over some updates possibly that have occurred since then. And then we'll move into the questions and the answers from the webinar in May at the end again. So I'm going to go ahead and hand this over to the panelists to let them introduce themselves and give you a little bit of background about who they are, where they work, what they've been doing over the course of the last several months amid the pandemic. I'll go ahead and start with you, Annette Waters, with ASPE. Why don't you go ahead and introduce yourself and we'll go from there.
Yes, my name is Annette Waters, and I'm a social science analyst in the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation. I am one of the lead researchers on the virtual case management portfolio that ASPE has now stood up, and I'm excited to be on this panel.
Susie, do you want to introduce yourself? You're on mute.
Hello, my name is Suzie Miller. I am a workforce programs manager at Arapahoe Douglas Works. We are the workforce center serving Arapahoe and Douglas counties in the Metro Denver area in Colorado. I have been in workforce development for roughly 14 years. I have worked in or operated nearly all programs associated with WIOA, workforce programming. I currently oversee TANF, known as Colorado Works here, SNAP ENT, known as Employment First, and a couple unique programs, one called Parents to Work program, which primarily serves non-custodial parents involved with child support enforcement, as well as a youth employment initiative that serves essentially TANF eligible youth, at-risk youth. Very happy to be here. Thank you.
Thank you, Susie. DADUAN.
Hey, everybody. Great to be here. My name is DADUAN, and I'm the manager of Special Projects, Operations and Training in Washington, D.C. with the Department of Human Services. And what I primarily work with our team in doing is pursuing funding opportunities and looking for more innovative strategies to increase our efficiency in the way we serve our customers and our families in the district. Our front office oversees both TANF and SNAP employment training programs. So we work with them as they pilot and scale up initiatives and projects that either provide direct service or work to efficiently streamline internal processes. Right now, we are looking into both case coaching and career pathways tools as we partner with the Workforce Investment Council, which is one of our larger partners in the district.
Thank you, DADUAN. We'll go ahead and move into the questions that we have. And we'll start with Annette, so we'll move into the next, or I'm sorry, the poll questions. And these are questions that we posed to the live audience last May, or 2 months ago in May. Please choose the sentiment that most closely aligns with how you're feeling right now about virtual coaching and case management. So one of the options is frustrated, optimistic, gratified, confused, and I'm not sure right now. So we'll go ahead and post the outcome of that poll question next. And it looks like 42%, a good percentage of those that attended last time in May were optimistic about the virtual platforms and the coaching and case management strategies. 16% were, you know, a little bit frustrated, which, you know, we all can get from time to time being in a different circumstance when you're trying to connect with individuals in need in a different way. And we had some that were feeling pretty gratified and others that were confused, and a good deal that weren't sure at the moment. So hopefully that pie chart has changed to more optimistic individuals out there as we continue to learn more through this way of doing business, new way of doing business. So we'll go ahead and get started with you, Annette, with some questions about the paper that you put together that really helped us understand this from a research standpoint, understand the virtual case management considerations and then the resources that are associated with that paper. Can you talk about what prompted you and the co-authors to produce that? What was sort of the catalyst?
So in March, when the stay-at-home orders were issued, and we learned that case management offices were not, human services offices were not going to be open, we knew we needed to quickly ramp up and figure out what is the lay of the land in terms of virtual case management. So it was the emergency that just erupted in terms of service delivery that prompted us to start the work in this area. And so we just scoured the literature. What are people saying about virtual teleservices? And the research was very thin. We didn't find any articles directly addressing the issue. So then we knew we've got some work to do in this area. In the beginning, we didn't hear a lot from the field about their concerns. We just knew that if services were initially, or not even initially, all the time were in person, and then we transitioned to something virtual, we knew there were going to be issues, both on the client side and on the programmatic side. So that's what prompted us to start looking into this area of virtual case management.
Great. When you and your colleagues were looking through the literature, doing that review, and you didn't find much, obviously that's a gap. But I know that there were probably other environments that you looked at that do things like telemedicine and so forth that maybe you gained information from. Can you talk a little bit about the gaps in the literature and how this might have been informed by what you were hearing from the programs or other federal offices?
So when we did our initial literature search, what kept popping up is telehealth. Telehealth is way far down the line in terms of service delivery and what they do compared to human services. So what we did is we looked at what are people saying in the telehealth space that could possibly translate to the teleservices space. And the VA is a leader in telehealth. Especially since veterans are all over the country and can be in rural areas and what have you, the VA has a very well-developed system of delivering services. So we looked at what the VA was doing in terms of teleservices, and we saw what things could translate into teleservices. Telehuman services. But there are some unique situations in human services. For instance, child welfare. Most child welfare engaging clients is in person. So when there's an investigation that has to happen, there's normally a caseworker that comes out to the house and, does an investigation and finds out if a child is neglected. So that's something very different with just regular teleservices. Or telehealth. So the human service side is different in that some things really do need to be done in person. In terms of what we were hearing back from the field, after time went on, there was a question, especially in the child welfare space, some things have to be done in person, how to keep caseworkers safe. And so that was something that we really looked at, is safety in terms of, with a pandemic, you have the clients who need to be safe and feel comfortable, and you have the clients, both caseworkers and clients. And so that's something a little bit different.
Thank you, Annette. Let's move on to some questions for DADUAN and SUZIE, letting them sort of respond to your research about, what you found, what you didn't find. Any questions, SUZIE and DADUAN, for Annette?
Sure. I think, do you think that there's some things that we can learn from telehealth in terms of how we can align multiple programs, expectations around securing PII while still ensuring service delivery in a virtual format?
Yeah, so in the paper, what we discussed, we found 3 key areas. First, there was identifying the technology. Then there was the training piece. And the last piece was privacy. So I want to start with the privacy piece. When services are delivered in person, you're in a room with a caseworker or a case manager is in a room with a client, and there are already laws in place to keep information private. When services go to a virtual environment, those same protections are in place. However, case managers don't know who's on the other side with the client, and the client doesn't know who's in the room with the case manager. And so that was one of the things that we found that is a really big issue, is around privacy. The other thing that we found is an issue is around consent and the signature. If you're not in person and there's no paper, going back and forth, how do you get that consent? So those are things that are different. The issues around access to technology and devices also came up. Not all clients have broadband internet access. And also not all human services agencies, their staff doesn't necessarily have all the devices that they need to do a virtual case management system. So those are the things that we found in our work that were issues of concern. However, as we are moving through this pandemic, people are getting up to speed. They're getting better access to technology. We're trying to deal with the lack of broadband infrastructure around the country, and trying to figure out some creative and innovative ways to do virtual case management.
DADUAN, do you have any questions for Annette?
I do. So I know a lot of the being able to connect virtually means that there has to be some level of trust. And I know I heard you speak about just the access and the privacy, but I want to go back to the technology. So as they were starting to kind of put this together, how did they begin to assess, or how did they initially assess what was feasible? Because of the technology that they wanted to use, or healthcare providers wanted to use to interact with clients or customers, what did that look like? How did they begin to survey? What demographics did they survey? And what did the technology look like at that point? And how often or how frequently did they assess, or do they assess? As we go into it this way, we don't have to recreate the wheel.
Right.
And I think the same is with access. I'm sorry.
No, these are excellent questions. So my colleague Kendall Swinson actually put together a brief on internet access using census data. And not all communities have the same access to the internet. So that's a real big thing, right? In the telehealth space, in the VA space, the VA has been doing some very creative things in making sure that their clients have the devices that they need. In the teleservices or the human services space, we've not progressed that far, right? So just trying to get clients the devices that they need and to get internet access is a big deal. Now, in our ASPE did a product on again, internet access. And what we found is that it varies by demographic group. For instance, older people who may be taking care of children whose parents can't take care of them, they don't use the internet as often or as much as younger groups of people. So if you're trying to do human services with an older person, that might not work. The other issue is, okay, say you don't have broadband internet access, you can do it through your smartphone. Not everybody has a smartphone. And so if you don't have a smartphone, if you don't have internet access, then we have to get creative in how we can reach people. I think we knew that these issues were issues all along, but what the pandemic did is just put it in vivid relief that we have to deal with this access issue if we're going to continue to deliver services. So I don't think we have it all figured out yet. I think we're just at the beginning of this, but we know the issues are there, and I think several groups are working to address this issue.
Great, thank you. So we'll move into the questions that we have for DADUAN and SUZIE, and the first one is really around what the first 2 weeks or so looked like for you after receiving word that you can no longer work face-to-face with TANF customers. You're both smiling. It's like, I remember that day. I remember what happened, kind of like, anything that's kind of poignant in life when you're like, I remember where I was and what happened. So I'll start with you, DADUAN. Let us know what that looked like for you and what some of the strategies, some of the initial thoughts and strategies and steps that you took with not only your staff, but the customers. What's the new way, the new norm of doing business?
So what we ended up doing was, as soon as we got word or got the phone call, our entire leadership team came together and we started looking at what's going to immediately impact the customers or families and who touches those families. And we started building out our operations plan to be modified from home. What could this look like? Who do we need to have at the table so that we could at least get something on paper to start getting that level of communication out? And second, I then started looking at my team because they are just amazing. Is we started doing a high level, almost like a SWOT analysis for our division. Where were our strengths and where are our opportunities? And we kind of shifted things so that we could start planning around our weaknesses and our threats, which were really, we needed more laptops and phones for our employees who had not been equipped with them or the internet access to work from home. But then we also ran into the learning curve of using that technology at home. Because even with staff, if I'm used to coming into the office, I've built a routine of coming in, working from this desktop, and I'm in this environment, I'm in this space, and I know who I'm working with, and there are boundaries set in place. Now I'm at home, and it's like the Wild West. I now have a client or a customer I have to work with, and it feels like there are no rules. So there was a lot of send your feedback in, we're going to get it, we're going to find a way to kind of build out these modules of training to make sure that you're well supported. So we have begun to kind of build these trainings of, okay, now that we are in this space, now that you all have laptops, what does virtually working from home look like? Because there is a learning curve. Customers are really wanting to find ways to engage with that case manager, with that case coach. And at home, we oftentimes feel safe. So even we've had to adjust to being at home, and it's a bit difficult. With the technology, it was just making sure that everybody had enough. So we really had to dig deep in what did we have, who has it, can we distribute it? And we started looking at a lot of our paper-based processes. And it really begged us to say, is this necessary? And why are we doing it this way still? And how can we enhance that process? So we're starting to kind of go back and look at how engaged the customers are in every step of getting them to be self-sufficient. So that's where we are now, is we're redesigning some of the pieces of how we engage with our customers through their initial assessments to how they get connected with their provider, or how they connect with external services or referral services. And so that's kind of what we're looking at now. And it's ever changing, because while we thought we were in a good space, kind of just to start, we realized we don't want to lose that momentum as things continue to change. So we love this direction. It's an unfortunate circumstance, but we love the direction.
So the opportunity side of that SWOT analysis continue to increase, I think, as time goes on, seeing things not so much as a, something that's a threat, but something that you can use. So I wrote down two things that you said, DADUAN. One is assessing what this looks like for the families was the first thing that you said, and that means a lot to kind of go to looking at yourself going, what does this mean to me? But really kind of reflecting on what does this really look like for the people that are in need that we're serving first, and then backing into how that impacts people that are actually serving them, right? So that's one thing that stuck out for me. And the other is like, what is necessary, right? Are all these papers necessary? Is all this process necessary? It's like business process re-engineering on steroids, where you're like, I don't think that is necessary, because it's not, it may not be doable. So that's interesting that those two things kind of stood out for me in what you said. And I'm wondering, from SUZIE, what did this look like for you and Arapahoe Douglas Workforce Center and those around you? What did you do? After your jaw dropped, what did you do?
Well, it's certainly, when you use the phrase that was like the Wild West, that is certainly resonates with me and what we went through. It really was purely a stage of learning. It was really learning to communicate internally, learning to communicate externally, looking at all of those new processes. It really forced us to do something that probably would have taken who knows how long to really dive into this, but it was never the priority, right? Is to say we need to look at how we offer services and expand our accessibility and start thinking about we can be just as efficient in a variety of formats. It doesn't have to be that traditional brick and mortar. So, but there were still components that we needed to address. We needed to really look at that referral process with human services, even though their processes were already in place for electronic referrals. There probably was still some gaps in communication, and that we really needed to address and shore up very early on to ensure that we were most effectively communicating and clearly communicating that message, and that it was consistent from human services to our agency. So that took a little bit of time. And then, really it was about, I think our transition with the customers maybe was, it felt a little less painful because of the methodology that we have in place for our case management, which is goal for it. And it's really focused to address barriers no matter the situation. So even in a pandemic, we can just shift that focus and still be as effective engaging our customers. And so the case management remains solid and effective even throughout this transition. And that was aided by some of the technologies we had in place that allowed us to quickly communicate with customers, such as bulk texting to really maintain that regular contact and to really quickly communicate process changes to large numbers of people. Additionally, we, within 48 hours, had up and running an emergency call center, and it was fully operational. And while the vast majority of those calls were maybe technically for unemployment and we're not the unemployment office, we were still able to help a lot of people get some basic questions answered or point them to the resources they needed to help in those times. So, you know, that I think they had fielded several thousands of calls in a very short period of time. So for us, it was the Wild West, but I think is the key word. We are beyond that at this point.
Yeah, for sure. So what did the first piece of communication look like that went out to the TANF customers? Were shut down? What did that look like?
It was, you do not need to come into the office for your scheduled orientation. You will be receiving a call between this time and this time, and we will conduct an orientation over the phone. And so we really wanted to get that message out as quickly as possible. We're going to call you, you know, just be ready for that. So.
Okay, great. DADUAN, Annette, Suzie. Annette, do you have any questions for Suzie and DADUAN?
Yes, for either one of them. So I've made the argument that the safety net is strong. It's not as strong as it could be, but it's still strong. And I think one of you said that you still delivered services, that you quickly got up to speed. So that's one of the things I want to, you know, I ask both of you. In terms of the ability to deliver services in this environment, I think we're effective. What do you think? I mean, that's a setup question, right? I think we're effective, but really, what is your opinion about
that? Absolutely. It will be very difficult to make. I mean, right now, we have career centers that have reopened for in-person service delivery for customers that need access to a computer, to file for unemployment, to search for work. But the vast majority, all of our case management services are still being offered completely in a virtual setting because the outcomes indicate to us that we are able to engage and effectively case manage and help these customers. Our show rates for orientation were in the 40s or 50s towards the end of last year, and now we're hovering right around 80% in our TANF programming for our engagement in that initial orientation. So I think that has eliminated many of the barriers, and so for us, we're looking at this as there's a lot of efficiencies that we've created, but more importantly, we're able to serve more customers.
And for us as well, what our service centers, they scaled back within the first few weeks, but continued to provide services, and they kept the vital services there. And they quickly shifted. So DC already has a call center in place. So a lot of the staff who were able to transition did, and they were able to continue to service customers. Now our employment programs, we really shifted there because that is really a person-centered design originally, where the customers are able to come in, they're able to engage, ask the questions necessary. A lot of them like that hands-on experience of seeing what they're getting before they move on to the next step. So that's where we were able to just kind of move a lot of our workers who work in the employment offices, our employment and training offices, we were able to shift them to say, okay, well, we can still have that same level of impact, but we're going to have to move that to a virtual platform. And so we also have our TANF employment providers who really jumped in, and they started to engage with their customers through virtual platforms. They started holding like group orientations through virtual platforms. They started having those one-on-one sessions with them, started reaching out, asking like, what's more comfortable for you? Is it phone? Is it video? What time of day works for you? So they actually started kind of collecting almost like these little bits of information of like what would work for the customer, what's needed for the customer. And just to follow in Suzie's statement earlier, I mean, to field that many calls during this time, it's a great thing. It's you never think we have to do it until you see it and you go back and you're like, wow, that, you know, we really did that. We really did that. And I think everybody across the board in all states are really pushing their limits, and we're in this new territory. So it's great to see.
Good. Thank you.
I will
So
just add to that, we're continuing to see positive outcomes even in the toughest of scenarios. Our county has been able to, I think we're going on the 8th or 9th month of exceeding the federal work participation rate sample pull. And so especially this last month, I mean, it's very difficult, but we're still probably might be the only county in the state to actually meet it. So it's a really tough time. There are still some challenges. You look at things like work-based learning. It isn't something that we're able to offer. And that's because businesses haven't been able to be open to be able to have to really give that opportunity for learning. So I think that's one area that we're really eager to see some more activity around. We did have a recent placement for a youth participant, a WIO youth participant in a work experience. So I think that we'll start seeing that revive, and because that's a very important service that we can offer to our customers.
great. That sounds amazing. Just seeing the light in some of what people feel are the dark times of this pandemic, is being able to connect. I think that's so important for so many of us, but especially those that already feel isolated and like, what am I going to do now? I lost my job, or, you know, I just got this job that I lost, and all of the different other unique challenges to individuals that are in need. So I was wondering, Suzie, you talked a little bit, and we'll move on to some more questions for you, Annette, in a minute, but I was wondering from Suzie and DADUAN, when you have an orientation that's virtual, is that over the phone? What is the mechanism that you're using to connect? And then secondary to that is, what are some of the conversations that you're having with TANF customers around their challenges? What are they initially presenting with that maybe was different than before COVID?
I can go ahead and start on that. In terms of orientations, and I'm continuing to challenge our staff to continue to make as many avenues. It's not just one way, it's not a one-way street. There's multiple avenues to access our services. So that's the same for orientation. So when we started, it was just phone over the phone, and we'd have the PowerPoint presentation that we could send out to them. But we've expanded that. So while in some scenarios it's most effective to do a one-on-one, we're recording the orientations and essentially putting them on YouTube, and we're connecting those into our Connecting Colorado, which is our statewide job database. So that's the Department of Labor's database. And because we encourage all of our job seekers and customers to be registered in that, they can actually access that link from there, and it will record a service in the system. So we're trying to really get those systems to work together. But that's one way that then we can ensure that they've watched that probably ahead of time. And then when we have the one-on-one orientation piece, it can be really more individualized and customized and really focused in on what that participant needs. In other scenarios, we are using platforms such as Zoom to conduct smaller group orientations. And there's some value in that because your participants then are able to hear other questions that maybe they hadn't thought about, but they get to hear the answer just the same. So there's something also about having a group dynamic where they might be able to make some connections among themselves, and we find that to be important. In our ongoing case management, our case managers are really reporting that the conversations are more in depth, and that's possibly due to a collective shared experience that promotes more willingness to share their own experiences. In some cases, it's perhaps easier to talk about a difficult subject without actually physically being in the room with the case manager, but we're certainly seeing a spectrum of perspectives. At least early on we were, some wanted to really focus on employment, needed that immediately, and that was kind of where our virtual job fairs were really beneficial to, for instance, our Employment First population really benefited. They were interested in finding employment immediately, and that was a way to connect them with a lot of businesses in a very efficient manner. While others have taken a step back and said, this is a great time to evaluate my long-term career goals and what steps must I take, can I be taking now that will prepare me better for when things do begin to reopen. So we've seen a lot of people say, you know, I'm going to renew my interest in passing the GED. I'm going to start studying again for the GED, or I'm investigating some other training programs so that I am ready to go and can be starting to access those as soon as they're available again. So I think we're seeing a variety, but I think people are all using this based on their own circumstances to really better themselves and get them into a stronger position as we move out of the pandemic.
Thank you, Suzie. DADUAN, do you have anything to add related to different kind of challenges, how you're connecting, at least initially, with TANF customers and then maybe ongoing?
Yeah, so for us, I mean, our service delivery model is really engaged. It's almost like it's not almost, it's a two-layered approach where our employment programs not only service customers who are education focused, which are our education occupational training customers, and then we have our job placement customers who are more job or career ready. But then that entire model is supported by our two-gen or multi-generational approach, or the approach itself. And so what we initially would do is we have two layers of goals and plans. Is we have an initial plan, which is done with our Office of Work Opportunity, and they deal with that initial assessment. So that's when you first get connected and you're talking to someone over the phone now. In the first phase of this, it was, okay, we're shifting people to now have the assessments done over the phone. And are we creating the same impact we would in person? And we realized, yes, we are able to still create that impact. We're still we're still able to reach outcomes and connect customers to their provider types or to the providers necessary from there. And once they get to the provider, if I'm education focused or job or career focused, I am then able to create a detailed plan that will address not just me, but my family's needs. Because I can't focus on education or finding a job if my family isn't secure. If I'm now unstable financially, then the home that I'm staying in, how long will I be here? If I have childcare issues or childcare concerns, where do I begin to address that as I'm also trying to focus on furthering my education? So what we ended up doing in the first two phases, it was like a two-pronged approach. It was, we're going to take our service delivery model and we're going to flip it so that it's virtually it's stable in this virtual space for providers, and we had our providers submit feedback to us about how we could kind of meet them where they are in that process of documentation, verifying these activities. How do we know the families are engaged, while also understanding they're also going through this shock and this trauma of losing their jobs. They're working with children at home. There's one computer there. There's distance learning on top of the adult in the home also trying to learn in that same window of time. We decided that we were going to try to put this, which we successfully did, put together a two or multi-generational incentive model together, which incentivizes supporting the home. So we don't want you to feel like you have nothing to do during this time. You can continue to look for work while on the back end, we're still working with OSSI, which is our Office of Superintendent of Education. We're working with the Workforce Investment Council. We're partnering with our Department of Employment Services. It's a full wraparound approach on the back end so that we can provide those education and employment resources to the family without a gap in services to them. They lost their jobs. We see that. We know that our employment services agencies are feeling that impact, but we also need to deal with the human that's also hurting in that space as well. So we're providing them a resource on the front end, while on the back end, we're building this new foundation in this space to prepare for whatever lies ahead. So we actually pulled customers in, and we're gonna hold another session shortly. It's a customer listening session where now that we're rolling out this 2-gen incentive model, how will this support your family? Things like exercising at home, or going for a walk, or opening a bank account and putting a couple dollars in your savings account. Things like that support your family. Being able to secure housing can be a difficult challenge to do. And for some families, they feel like it's not attainable. But if they're working with their providers and they're having those coaching conversations, then these things can be broken down into more manageable goals that are achievable. And we want families to celebrate those smaller successes, because we know that they've kind of dealt with a greater loss in this window of time just since March. So there's a lot of moving parts to this. There's a lot of great people who are really investing time and energy into just pulling all of these pieces together. But it's truly a layered approach. So right now we have our providers who are still submitting feedback. We're looking at creating a customer platform so our customers have the ability to engage with their provider virtually. And also we have the agency as a whole, we're working to kind of move this entire model, not completely virtual, but almost optional, because we realize families don't mind engaging from home or engaging where they are. And we want to take into consideration access of technology and internet. And as well as internet access, as well as not even just having the technology, it's having access to the internet, which seems to be a big issue here.
Thank
Can
you,
I say something? Can I say something about what DADUAN just said? So we're not going back to the way we used to do things. This is a new normal. Mm-hmm. And what the pandemic did was, I think, DADUAN, it was you who said, what is necessary in person? Why do we have to do this thing this particular way? And so what the stay-at-home orders did was, it actually gave us license to create something that we could not create before, and to meet clients' needs in a way that we've not been able to do before, because we were forced. I think SUZIE said that we were forced to make real serious changes very quickly. So we're not, and I do believe there'll be a time when we do not have a pandemic. When the pandemic is gone, when there's no more COVID, I don't see us going back to complete in-person delivery. As SUZIE said, her show rates have gone up. So why would we go back to something that would cause our show rates to possibly go back down? There's something that's working here. So that's it. I just wanted to say that we're in a new normal, and we have an opportunity to create something that we have not been able to do before.
Yeah, definitely. Thank you so much. That's great information from all of you. I'm going to move on to the next slide, and it really involves a poll question again that we posed last time. What tips are most important as you think about needs related to virtual case management and coaching practices? So is it about a safe environment for coaching the customers, technical systems and platforms, acquisition, broadband access, trauma-informed scripts to use with customers during crises? Or you're just not sure right now? And what came out of this poll question is that the majority of people want a safe environment for coaching customers. So whatever that means is, you know, whether it's technology, whether it is conversation, that they felt like that is most important. And then the technology, of course, and acquisition to broadband came separate with, came in second, almost equally related to that, the ability to connect, the ability to have connection and be able to connect over some platform that makes sense, and then the trauma-informed scripts, and I'm not sure right now. So those were the numbers of people that responded and the percentages connected to those. So that's interesting. Safety first, of course, and I think safety related to a personal connection, their own physical safety from the pandemic, as well as you know, like you were talking about, Annette, I believe, the PII and not knowing who's in the room when you're connecting virtually and so forth. So safety could mean a number of things, but that safe connection being most important. So we'll move on to some more questions for you, Annette, related to, or I'm sorry, and I think we connected over this a little bit too in the last questions about the technology that you're all using, but maybe we can dive into that a little bit more and have a conversation about that technology and the training to the customers. If they haven't used a Zoom platform, or they haven't used, you know, whatever. I know Zoom is used quite a bit, but I know that there's other platforms that I probably am not familiar with. So Suzie, or I'll start with you, DADUAN. What types of technology are you using to connect? What is the primary and maybe secondary, and how did you go about training the customers on that technology?
So for customers, it's a bit varied. I know when the agency reaches out to customers, we primarily use WebEx, and that's more commonly used. What we have been doing is reaching out to customers if they're not familiar, and we'll reference them to videos, or if it's some level of technology that they're not familiar with, we'll usually ask them to reach out to their family, or reach out to the teenagers or youth in their family. Being stuck at home, you have access to other family members who are also at home. So it's been a great opportunity to allow them to reconnect with one another in their own circles. But we've done it on both sides, because while we've had issues with customers not being familiar with the technology to get connected and to participate or engage in some of the things that we've put together, we've also had that challenge with sometimes ourselves, just staff coming together and trying to get connected to Zoom and muting microphones, and Microsoft Teams as well, because we use that quite heavily. And I know some of the customers with different agencies have done the same thing as well. Well, they'll use Teams or Zoom. But those are the primary platforms that we use. I know we are working on another platform. I'm not exactly sure what that will be, but I have my training team right now. They're awesome. They're gonna start looking at ways to start putting training modules together to look at not just the technology, but looking at the access to it, what are some of the minimum requirements, kind of pulling all of that stuff together in one space. So if I'm accessing Zoom, what are the minimum requirements? If I'm accessing WebEx, what are the minimum requirements there? Because it's sometimes like, oh, I didn't know I needed to connect to this meeting or this town hall or this orientation, and I've never used this platform before. How do I get connected? So we want to distribute that out to our providers sometime in the near future.
Oh, nice, very nice. Suzie?
So I think at some level we were already engaging with customers through email. So our customers were already familiar with being able to submit stuff to us through email and using apps on their phone like CamScan to convert they could take a picture of it and convert it to a PDF and send it to their case manager. So some of that was already in place. I think telephone at its very basic and simplest level is a form of technology that is accessible by the vast majority. And so we use that as much as we can and when it makes sense. But for those more advanced platforms, we're developing a series of like bite-sized kind of clips that they can play, even if it's about how to fill out one of our forms, like here's what you need to put here and this is how you need to do it. So we're creating these little bite-sized snippets that they can send out to the customers. Again, like I said, mentioned earlier, we used bulk texting to really quickly connect with our customers, and they're usually really pretty responsive via that avenue as well.
So when you create the bits for the customers to kind of train them, what are you building that in, Suzie? What do you know the platform that you're using to build those?
You know, we're trying to make it as accessible as possible, so they'll be on like YouTube. And on our website, so we can direct them there to get that information.
Okay, great. Annette, do you have any questions for Suzie or DADUAN related to the technology that they're using and training and coaching customers around that technology?
I had questions around the training of staff. So even in my office, you know, we're pretty tech savvy, but some of this, just learning all these different platforms, it's been a challenge for me. And I'm on technology every day. I'm using it every day. So in terms of your staff, have they had issues around learning all of these new ways to communicate?
Oh, there were plenty of issues. Yes, absolutely. Yeah, I mean, anytime you experience such enormous change, you're going to have multiple ways to help people learn. And so sometimes it was one-on-one coaching. Sometimes we offered tech talks that were very short sessions about specific things like how to use MS Teams, which we use primarily for internal communications. We have and continue to have daily lunch and learns on a variety of subjects, including technology, mental health resources, or other community resources available. So we tried to incorporate as much learning as we could on a regular basis, using even platforms like Trello to be able to kind of house all of that technology resources, and people can go there for more learning information. So we were really approaching it from that perspective. We are pretty excited about accessing some of the CARES funding, and we're developing and we're working in collaboration with a local community college to develop curriculum for now that we are figuring out how to work remotely. We're developing curriculum to put our customers through how they can work in a virtual environment, working from home and gaining some skills so that they're more employable as we go forward, and looking at if we can offer, like as part of that completion of that, perhaps a tablet or a laptop or some sort of technology that's going to help them continue to be successful in their employment search and in employment once they secure it. So we're really excited about that. That's been a recent development.
That's amazing. That sounds really, really awesome to be able to, you know, give them skills and then give them something that they can, you know, use with those skills. So that's great. Thanks, Suzie.
Yeah, I think right now that's a big challenge. The vast majority of our funding sources don't allow for us to be purchasing technology for them or helping them that way. So I think that's still an area that we need to explore and see how we can. We've had some early initial conversations with nonprofits that perhaps have more flexibility with their funding. And as they look towards planning their upcoming goals over the next year, we're really encouraging them to look at providing those opportunities to increase accessibility to technology for those in need. So I think we need to continue those sorts of conversations and really advocate for other funding sources to be able to support these efforts.
Yeah, definitely. Okay, great. Well, we'll move on to the next set of questions, kind of to Annette. We're talking about the research brief again related to telemedicine. And I know that we touched on this a little bit, but I wanted to give you an opportunity to talk through anything that might have surprised you, things that kind of stuck out when you were doing all the research and lit review and other reviews around telemedicine, and maybe what might or might not work for the human services arena based on what you learned.
Well, the thing that surprised me most was that I didn't find anything on best practices. Like, how do you do human service delivery virtually well? How do you do it? And it wasn't an exhaustive, like I didn't like look at every piece of literature out there in every library, but just from we did a fairly thorough search. There was nothing to kind of guide human services in terms of research, like what is the research is saying this is working or that this doesn't work in human service delivery when it's virtual. We didn't find anything. So that surprised me. One of the primary learnings that human service workers can take from telemedicine is that it is effective. It's a very different way of interacting with clients. When you don't have a client in front of you, it's kind of hard to read body language or pick up cues that you would normally pick up when you have someone face to face. And that stuff is very important in helping you kind of figure out what direction maybe you need to push a client in or how, what services they need. Some of that body language stuff is real important, and you can't do that really well over the internet or, over the phone like that. You can't do it. So how to still keep clients engaged and keep them connected to you. There was also not much research about that. So those are some areas that I think we need more research on, how to do this well. What are the best practices? Gathering that information. The other thing that I would love to see is for somebody, and Susie touched upon it, pre-COVID, what happened? Post-COVID, what happened? How and why? That would be really useful for the field so that we could look and see these services, and I'm talking about after COVID is gone, these services can be delivered virtually, but there's some other services that we really still need to have in person. We need to do, but we don't have, right now, we don't have any data on that. So I'm hoping that human services programs track this and start putting out their own research papers on what happened, what works, what doesn't work, what do clients prefer. That's another big piece. It seems as if for some, like, again, I go back to the show rates again. For more people to be almost, you doubled your show rates, right, Suzie? Okay, that's amazing. So to have that kind of impact, what else is there out there that you haven't even had a chance to look at yet? That doing it virtually, clients like it. To me, that's how I would interpret that. The clients like that aspect of doing things virtually. Others may not, but again, what's the lay of the land? What are the lessons learned? So I just had a couple I got poison ivy, right? And I'm welts all over me. And I had a telehealth visit. It was absolutely great, but it was great because I had the right kind of device. I have a smartphone, very easy. And a lot of telemedicine, they're heavily relying on the smartphone. So if our clients don't have smartphones, what else do we do? And I had one of you, it was DADUAN or Suzie talked about not having enough devices in the home. which I had not even thought about that. I'm thinking, oh, if you have an internet and you have a computer, you're connected. But one of you said it, that's just the beginning, because the kids have to learn and parents have to do workforce development training, or you've got competing interests there, and somebody's needs might not get met. I hadn't even thought of that. So telemedicine, one-to-one, makes sense with the smartphone. If you've got multiple people needing to access services at the same time, that part is different. And I thank you ladies for bringing that up, because that's something that I will take back to my group for us to actually talk about, because we had not looked at that yet.
Yeah, great question, and great thoughts. I know, you know, just watching in my own environment and family and friends, that the competing for the devices is huge. Like, I have grandkids that are competing for one laptop, and they all need to do homework from that. So I can imagine, you know, and competing to work and that schooling aspect, because it just isn't about that one-on-one connection with a case manager or a coach that's maybe short term. It's what you have to do after that, right? Connected to employment plans or whatever you want to call them, roadmaps, the goals that they set for themselves and how to carry those out. So that's interesting. All right. Any questions for Annette, DADUAN, and Suzie related to the telemedicine aspect? Anything else?
Yeah, I do, because the educator started coming out of me when you started talking about just and the nonverbal communication. I mean, not physically being with a client, but being over the phone with them. That kind of goes back to the beginning of the conversation when I was trying to pull apart what surveys were done when telehealth first took off. You know, and there may be a lot that's done but not published. There could be surveys that were done in the beginning, but they felt were insignificant, or there was insufficient data, or maybe it wasn't categorized properly. Like, I don't know, but what questions were asked, because we're in this space now of, if I don't prefer to use technology, the follow-up or the clarifying question would be why? Or is there a miss in that learning curve that we're not seeing? And if there is, then we can fill that deficiency. We can build that bridge, but we have to know what it is first. And Annette, to share, we're starting to run into that. And that's why I brought it up earlier, is there's one laptop in the home, and usually we're taking off for ourselves. We take off maybe in the morning to take the kids to the doctor's office, to then take them back to school, or we kind of make those plans throughout the day. But think about being at home and there's one computer or there's one phone, and like right now, you know, if I'm in a meeting and there's content that I have to engage with, if I'm on a phone, the phone is about that big. Imagine having to engage with content that big while you're really kind of handing off the laptop or the computer to your kid, because you really want them to engage and focus for distance learning while you're trying to finish maybe that GED or vocational course or finish your degree. All of those things are important. So when we talked about capacity, it's really how do we address it, and who do we ask? And if there's a learning curve, why is there not a learning curve? But if there's a deficiency, what is it and why? Which is why we're starting to ask those questions, and we're starting to kind of survey our families. The biggest piece, or the question I would have in that, really goes back to consent. Because if I am just adamant about not engaging virtually, and I want to sit in front of someone, even during this pandemic that we're going through, what could that look like, or what does that look like?
So I want to go back to your first question, and then I'm going to come back to that one. I didn't see any, and again, my review of the literature in telemedicine was not exhaustive. Like normally you would have a team that would go in and they would pull 1,000 sources and scale down and, get in vivo involved and, but we didn't have time to do that. And we didn't have the capacity to do that. I didn't see anything to address what you're asking, which means the way I would interpret that is this is an opportunity for us to do some real serious work asking those kinds of questions. In terms of capacity, I got you. I mean, because most households, to get one laptop, especially among our clients, to have one laptop is a big deal, right? But now if you've got 2, 3 kids who are trying to do distance learning and parents need to do a telehealth visit and SUZIE engage with your office, it's not going to work. And so again, this is our opportunity to build something that has never been built before because we've never had to do it this way before. And I don't know what the solution is, but we raise the question and then we all come together and kind of brainstorm how to get this done. And then the last question, it's slipping my mind. What was the last question you asked about consent? The consent piece is, so in the debt management world, they do verbal consent where they're audio taping, you agree to, and they read you a long script. We don't have typically that kind of technology, but it does seem like that is something we might want to consider, the verbal recorded consent. The other thing, and again, this goes to around training, DocuSign, right? I even had problems with DocuSign. How can we get our clients to do the the digital signature, or even on Adobe Acrobat. I've had problems because I didn't have the right version with Adobe, and I know Adobe Acrobat, right? So there's going to have to be a lot of training. SUZIE, you talked about the little snippets of how to fill out the form. That stuff is very important. And most people are comfortable with YouTube, right? So if you can't get to YouTube on your phone to figure out how to fill that form out or learn how to do, because even in my work, I Google how to do XYZ with Outlook. I do it all the time, and they've got all these cool videos on how to get your calendar to show up or whatever. So we're pushing more people to the internet. We're using the internet in ways that we haven't done before in human services. So there's going to be this ramp up of getting comfortable with technology. Like I said, older people can learn. Yes, they can. But the struggles that my dad is 91, trying to get him to download a picture from a text message. It was a little challenging, right? So just dealing with him as an older person, being much more patient with older people, and I brought this up when we had our other, we did the webinar before. This is an opportunity possibly for younger people to teach older people how to use the internet, how to use devices around. Now I'm sure somebody must have done it already. Jobs for young people to teach older people how to do the internet. But that would be something that would engage people in a way that's very creative. And if it's like my mother's grandchildren, how do you do this? How do you do this? How? And I send her off to the grandchildren. They can teach you how to do it. They do it. So it's a 2-gen in my family, 3-gen approach. As my mother's asking me, no, not going to do that. Talk to your grandchildren. There's a 3-gen approach of how to get older people trained up on technology. If it has to be done in person, then how do we protect both clients who might not be comfortable and case managers who might not be comfortable doing things virtually? That and the protective gear and how do we do that? these are things that, again, we're inventing something that has not been done before. And to me, it's exciting because we can get a system that is more fluid and nimble and more responsive to clients. That's my long answer to your short question.
Thank you, Annette.
I love it.
All of that really resonates for sure. You know, learning things from my young grandkids and those around me that are younger. And, you know, when I grew up thinking I knew it all. No. All right, we'll move on to the next set of questions. So, and again, we probably covered some of these already, but I think what stands out here from these questions is really and I think the $1 million question is, what does participation in the program look like now? Where here I am, I'm working as a customer in the TANF program. I'm getting great coaching, great support. I'm connected to, you know, community college or GED program. I'm moving right along, and then all of a sudden, the Wild West really happens. And what does a change in my program or my plan look like now? What does participation look like? How has that changed? What new and different things are you all doing, DADUAN and SUZIE, related to participation in the TANF program?
We're taking, I know in the district, we're starting to look at how we verify information. We're really document and paper heavy. So again, it goes back to those questions of, is it necessary? And we almost use this model of, yes, it has been used for quite some time. So what is working? What has continued to work, but we may no longer need? And then we start to introduce new ideas, and we start kind of going through this cycle with almost all of the activities and all of the ways that our families and our customers engage. And once we're able to kind of start that conversation, it really starts to pull away some of the unnecessary, or not unnecessary, but some of the parts that have served their purpose in our program. As technology has evolved and as we have learned more, it has allowed for us to kind of exhaust all of those resources for that time period. And now we're in this new normal, and we're saying, well, we get to create the new normal. And what does that new normal look like? Or what do we want it to look like, really? Because now it's, how do you verify employment? It used to be you could walk to that employer and verify it, or I could call them and ask. And we're in this space now where, well, I'll just shoot them a quick email. And even then, you're looking at the signature on the email. You're looking at the email address itself to make sure that it's not fictitious. We want to make sure, you know, we just want to make sure that it holds water. When we talk about 2Gen, and we're talking about that multi-generational approach, because that's how all of this is going to continue to stand and our families will continue to elevate. It's actually allowing them to be independent and self-sufficient. Our families are a lot stronger than I think we give them credit for. They are extremely resilient during this time, and they'll let us know what they need and when they need it. And I think for us, we really can focus on being prepared for when they need us. And that allows us this time of just going to them and saying, what would you like to see? We are going through this together, and what do you think the next few years will look like? Or how can we support you in these spaces to build these bridges? And that's, I don't think we'll be able to do this work without asking our families and our clients what it is that they need and when they will need it. They know what they need best.
Mm-hmm. Yeah, definitely. SUZIE, what do you think? What does this look like now?
Yeah, no, I mean, I think that one interesting point that I maybe is unexpected that I think that we've started to see is that because customers are able to meet with us for those follow-up appointments over the phone, and because we're delivering services that's more accessible, we're seeing less sanctioning, less conciliation. They're staying on and engaged with the program, which has multitudes of benefits, right? We're able to continue uninterrupted service delivery to them. We're able to reduce the amount of paperwork on both ends, like in terms of, oh, you know, sorry, your case closed, you got to reapply, or whatever the case may be. So we're seeing more efficiencies, and we're able to maintain those relationships that really are producing better outcomes. I mean, we have our participants are still getting virtual interviews. They're still submitting applications. They're getting GED one-on-one mentoring and coaching. They're taking online workshops. They're applying for their training and education programs. So I think the level of engagement we're seeing is because they are really far more adaptable than we maybe even thought they were capable of being. So I think we're seeing a lot of really positive outcomes.
That's good. I can tell with your smiles. I really can, about how you feel about this work and how it's evolved since COVID started. You know, that initial shock of what are we going to do and how are we going to do it, I can only imagine. And then moving and seeing all of the different ways in which the work can be done, and the outcomes kind of following along. We always thought, you know, they'll come along if we do the right thing, right? And they do. So that's great to hear. I'm going to move past this slide too into some other questions, because I feel like we covered some of this about the interactions between the coaches and the case managers. But to Annette, drawing upon your key considerations, what do you see in terms of the challenges for the human services programs when implementing these new systems? And I think since the webinar in May, have you learned anything new? Have you researched anything more? I know this conversation brought up some good research questions for the future, but is there anything else that you kind of came across over the last couple of months that you were surprised about, anything like that?
Yes, actually, the digital divide. So I didn't know that even in a city that you would have sections of the city that didn't have broadband internet access. I didn't know that. So that was something big, because I thought the issue with internet access was like an urban-rural split or frontier communities. I didn't know that. Like, I was talking to some of my colleagues at HUD about public housing, and a fair number of public housing buildings are not internet access, don't have internet access, which was a surprise to me. I didn't know that. So when we're talking about these new systems, the issues around infrastructure, which I had never really paid much attention to, are big. They are substantial. And so, like, back to DADUAN, who was talking about kids learning online, if you don't have access to the internet and you don't have a device and now you can't go to school, what do you do? Yeah. And you can't even go to the library because the libraries are all closed. So this just, the connectivity issues, that part was something that I just didn't know about. And it's something that has to be faced. And how we do that, I don't know. I think conversations are going on right now trying to address these issues. The feedback from the virtual case management brief has just been amazing. It's something that I didn't foresee. But I think it's right, because this is what we have to do. We have to deliver services in different ways than we have before. So I've been asked to speak and to present and to talk about these issues. And, you know, people want answers, but without the proper research, I can't give you like an informed, this is a best practice. So for any researcher out there that's looking, or graduate student looking for a project or whatever, please step into this space, because there is lots of work to be done. And for me, again, it's the pre and post COVID. What works better virtually? What doesn't work better virtually? And how do we make the determination of what to do? It's going to be definitely very community specific. Because I was on a call with some colleagues, and they were talking about that some communities who's trying to deal with this access issue actually have a school bus that has Wi-Fi. And then the kids come to where the school bus is, like in a parking lot, and on their phones, they're doing their homework. That's pretty cool and creative. You know, that's what I'm saying. Just because stuff is not in person anymore doesn't mean we drop the ball and we do nothing. So whatever school district this was that said, well, Wi-Fi on the bus, creative. It's not ideal. To me, learning should still be with a teacher in a classroom. I believe that. That's the way I did it. You know, most of us did it that way. And kids need that interaction with teacher. But if you can't get that one-on-one interaction, what's the next best thing? Because learning has to still continue. Mm-hmm. Services still have to be delivered. And again, we just now have an opportunity to build something that to me always needed to be built. But it was DADUAN or SUZIE, one of them said, but you know, it wasn't on the front burner. I think it was SUZIE. It was always a back burner issue. Now it's in the front burner. And so, you know, we have a window of opportunity. Let's run through it as fast as we can, and let's do some things that are a little bit out of the box that normally we could never do. But because of the pandemic and the issues around access, I think it gives us license to be very creative.
Mm-hmm. Yes, definitely. Thank you. I'm going to move to the next slide. I'm doing a time check. We have about 10 minutes left, so I want to get through a couple more questions and give anyone from the Office of Family Assistance a chance to ask any questions they have, and then we'll go ahead and sign off. I'm sure we can all talk about this topic for a very long time, especially all that's been learned over the course of the last several months, and the realizations and opportunities ahead are just so great. DADUAN and SUZIE, can you talk a little bit about what has changed since the live event happened? We talked a little bit about that with Annette just a minute ago, about anything new that's kind of come up. But what's happened with you all since May? Anything new that you're doing? Anything, adjustments that you've made since then? Any discussions about that digital divide? Anything like that you want to talk about?
Yeah, so we've done a couple things, or we're working on a couple things. We are working with our education partners to continue surveying what technology is in the home and what families have access to. Here in the district, we have, of course, you know, the government buildings, our libraries, our recreation centers. All of those locations have free internet access, but of course, during phase 1 of the pandemic, all of those places were closed. So we're really back at square one. There is a resource here for families, Internet Essentials, that allow families to connect and have access to internet, but a lot of our customers still have questions about connecting. When they don't have everything in the house, is really more or less about the bandwidth. And if I do have multiple children in the home, or I do have a spouse, then I'm going to run into issues. I'm not going to be able to connect. I'm not going to be able to efficiently engage in whatever coursework I need to have completed. So that's number one. So we're working on that. The second part to that is we're working on enhancing our career pathways tool that we've been working on as a part of the PACE grant. In our case coaching model, we thought we were ready for our pilot. And then this happened and we realized, we have to go back.
Mm-hmm.
We built our career pathway tool in a way that really spoke to customers who were receiving public benefits and what that would look like as they gradually came off. And there are other engaging tools, a part of that pathway tool that we're extremely proud of. And I'm extremely proud of my team for all of the work that they've done and invested into that project, and as well as case coaching. So now with the case coaching model, we had to go back and we had to pull it open and say, okay, now we have to think about virtual case coaching and what does that look like? And does it have the same impact with the family if I'm not physically there? And now I have to listen for verbal cues or the tone of someone's voice to see whether or not I need to ask a clarifying question, or should I not, or should I pull back? What does that look like? What does that not look like? I haven't, and if it's a new client that I haven't built that rapport with, then I might not know. So this is this new space that we're learning in, that we're really kind of jumping both feet in, because we don't really have a choice at this point. But we're truly excited to pilot this and see where this takes us, because it's almost perfect timing. We were working to have this kind of kick off around March or April, because that was the original date. And now we're preparing for it really to go pilot live in July. And we were trying to capture the school year when kids were still in school, or parents were still trying to engage with their education partners. But now we're kind of in this summer space, and we realize that there may be downtime. So we may look at this and say, okay, well, how long do we want to extend this pilot? Does it need to last a year, 6 months, or a year? We're looking at those variables now before we kick this off. So that's really exciting. And we're building out our enhanced customer portal, which is also virtual, because that has also been something that has come out of this.
Very cool. That's neat to hear. Suzie, do you have anything you want to talk about related to what's happened since May?
Sure. I've talked about some of that already, but I think a couple of things. As I mentioned, we've reopened some of our offices, the career center pieces of it, for limited, like essentially appointment-based access for in-person service delivery. And it's interesting because we have 2 locations, and one's in more of an urban area and one is less so. And the main one that we opened up was kind of the less so, and we have experienced just more calls than we have probably in-person walk-in appointments, coming in the doors. The other one is very different. We have constant traffic into that building, and I think that that's an important piece for us to recognize, is that there needs to be, again, that accessibility. And so we had to be innovative, even in just ways of how do we create a space that we can provide assistance that meets social distancing standards. So we ended up like setting up computers kind of kitty corner from one another, that were at least 6 feet apart, but the screens were mirrored. And so the case manager can type and move the mouse, and the customer can see exactly what they're doing, and vice versa. So there's this learning that's happening. So it's kind of cool to see us be able to work like that and be able to offer services. And just the demand that we're seeing is probably, kind of what we anticipated. And while a lot of it's around unemployment, we're still able to really help a lot of people that weren't getting assistance when we were completely shut down. So we're seeing that as something that's important. And one thing that I think is kind of innovative that we're doing in a partnership with the city of Aurora, and there's a lot of other partners, there's a housing grant that they're kind of uplifting at this time. And we needed to find a way to share information about our customers that was secure and safe. So they actually created a Microsoft Teams room for all of the people and all the partners to be a part of and share documents that way to ensure that they're on a secure platform. So I think just little wins like that demonstrate our ability to be nimble in this environment and really just provide a level of anticipation and excitement about what we can do in the future.
Nice. Thank you. I'm going to move on quickly. We have just a few minutes left to the next slide about I think that's the last poll question that we posed last time in May about the primary virtual platforms that the TANF agencies are using right now to connect with clients. And it looked like the results is really about, the telephone being the primary way, about 11%, or I'm sorry, 72%, and then Zoom being second to that, and GoToMeeting, those platforms. So it looks like that may have changed over the last few months, I think, with people getting more and more comfortable. But want to move on to the next slide. So. And I'm going to move past these questions because we just have a few more minutes, and I wanted to get, and I think we did kind of go into them from the last time, about the PII and things like that we talked about. So wanted to give the Office of Family Assistance the opportunity to ask any questions that they have. And then this last part is really about the website related to connecting to OFA Peer TA, getting any assistance that partners throughout the country, TANF partners, can access resources. And I'm sure there's a lot of questions that they have, and that's what we do, is connect people to one another, like you've been able to connect to one another around questions and ways of doing this work better each day, and connecting to those that need us most. So I'll hand it over to James Butler and those at the Office of Family Assistance to kind of wrap things up and ask any questions that they have. James?
Yes, I just have one very quick question, and most of you had touched on some of it already, but just given the various types of technology that people have had to tap into because of COVID, did your staff have work laptops prior to COVID, or were they distributed laptops or computers afterwards, or are they using their personal devices?
The vast majority of our staff were using their own personal devices and remain using their personal devices. We did have a group of laptops that we could issue out for those staff that did not have the appropriate technology. And then, like the leadership level, I think most of the leaders had laptops. So we're hoping that some of our CARES Act funding can go towards the county looking at rolling that out for everybody, but who knows what that looks like.
And for us, it was a mix of both. We had a lot of our outreach teams and a lot of our front-facing staff did not have laptops. However, our administrative teams did, and we do have laptops that were kind of on site and at our headquarters. So we were able to distribute those. And we started to work with our Office of Information Systems to kind of distribute what we had in stock to all of the rest of the staff based on priority and need. So that continues to happen as we continue to provide services.
Great.
Thanks. And then unless Lisa has any questions, I think we can go ahead and move into wrap up.
Okay. Lisa?
I just had one question. This is for anyone. If you have people, as you begin to reopen, if some of your customers aren't comfortable coming to the office, will you give them a choice of continuing with virtual case management, or what will the solution be?
Right now, for us, I know we are looking at that to be an option because we do understand a lot of our customers live very close to service centers, so they have the opportunity to either walk to a service center or take a bus. And if they prefer to engage virtually, then they may have that option as well. But we want to make sure that we have the capacity for them to engage virtually without, any issues from start to finish.
We certainly plan to do our best to ensure that there's as many ways possible to engage and access our services.
James, did you want to go ahead and wrap up?
Sure, no problem. Yes, so we just want to express our sincere thanks and appreciation to everyone for participating in today's webinar. As always, thanks to our presenters, Annette, DADUAN, and SUZIE, for taking time out of their busy schedules to share with us today. And most importantly, those of you who have joined us. We hope the session has been informative, and we look forward to continuing our work with you as part of OFA Peer TA. If we weren't able to respond to your question today by chat box, we will provide you with an answer to any questions and make them available on our Peer TA website in the very near future. If you have further inquiries, feel free to contact me or Mary Roberto at the email addresses that you see before your screen. Thank you all so very much, and have a pleasant remainder of your day.
Thank you all. Have a great day.